This is April 15th, 2021 at 7 o'clock. Present, Department of Municipal Licenses and Inspections, Mary Beth McGrath, Director, Dr. Philip Nettleman, Vice Chairman, Dr. Arthur Bergoli, Chairman, and the newest member of our board, a resident of Braintree, a graduate of Thayer Academy, a graduate of Clemson University's nursing program, a registered nurse at Mass General Hospital, which she probably is right now, in the cardiac step-down unit, and now her newest job, the Braintree Board of Health, our clerk. Congratulations and welcome, and you have big shoes to fill. Juliana Melchionda.
Absolutely.
If anyone else would like to say something, please go right ahead.
I would like to welcome her with open arms, and I'm sure she'll do a wonderful, wonderful job.
Thank you.
Thank you. I appreciate it, guys. I'm very excited to join you all. I'm excited to learn from you all and see kind of a new side of healthcare that I haven't seen yet. And, you know, it really is an honor to have this opportunity to carry on Mom's legacy. So I appreciate it. Thank you guys so much.
And thank
Things will be a bit boring for a while, but we'll try to spice it up for you a little bit.
That's all right.
Right now, we're sort of stuck on chickens.
All right, Board of Health meeting agenda, April 15, 2021, 2 pages. Approval of the meeting minutes, March 11th, 2021, 3 pages. I know Juliana was not there. Dr. Philip Nettleman, would you like to put forth a motion for the approval of the meeting minutes from March 11th?
I move that the minutes be approved as read.
And I will second that motion. All in favor? Aye.
Aye.
Okay, so Julianne, just so that you know, as we're on Zoom meetings, once the board members take a vote, then we have to request a roll call of each of the members, because while we're in Zoom session, when we're in physical session, it's not necessary to do that. So I'd ask for a roll call from Dr. Bergoli
Yes.
and Dr. Nettleman.
Yes.
List of complaints received from March 8th, 2021 through April 9th, 2021. Mary Beth will discuss.
Sure. So normally, Juliana, I'm going to kind of just walk you through as we do each of the individual items, if that's all right. I normally would present a list to you of complaints received between the last meeting and the present meeting. We get complaints on absolutely everything you can imagine. And within the last year, the majority of our complaints, as you can imagine, are COVID related. So that would be face coverings, that would be the social distancing requirements. That's been the majority of our complaints. And since we've been getting so many of them over the last year, instead of putting it in writing for the same thing over and over and over again, I just bring it to the board as a verbal now and explain to them that's pretty much still what we're involved with. As we're rolling into the spring and the nicer weather, we are getting a few more trash complaints, which that would be normal this time of the season, as people are getting out of their houses and the wind tends to blow and we kind of are cleaning up all of our winter activities that happened as we roll into spring. So that's been the majority of the complaints to date.
And in the summer, we get complaints from the transfer station, the odor. And I think we should tell her also that the complaints come from the citizens.
They do.
The vast majority.
Right.
They call in?
Well, the complaints are called in, people walk in, they send emails. So there's lots of different modes of communication to get a complaint to us. But whether a complaint is registered by an individual that leaves their name or it's anonymous, we do have to investigate it to determine its validity.
Okay.
Thank you.
New business. 1, request for variance of lifeguard provision, Turtle Crossing condominiums, 501 Commerce Drive. Variance request, 22 pages, and regulation, 1 page. Mary Beth.
Sure. So before you this evening, Turtle Crossing Condominium Association, which is located at 501 Commerce Drive here in Braintree, has requested their annual request for a variance of the lifeguard provision. And their lifeguard request for the provision is not to entirely not have a lifeguard during their bathing season, but more to modify it. And because they're slow on the weekdays, they're requesting that they not have a lifeguard Monday through Friday, and Susan can help me with this, Monday through Friday, when persons are at work, the residents are at work, and pool activity is much lower than it would be on the weekends and holidays.
That's exactly right. And we actually, right, so if Monday or any day during the week is a holiday, we would also have lifeguard staffed. This has worked out really well in the past. Myself and my maintenance super is on site Monday through Friday as well. So we're able to, I mean, we're not lifeguards, but the pool is right outside my office, so I am able to monitor it just to ensure that everybody is behaving and following restrictions, especially this year. We'll be looking for that as well. So we would like to continue with that variance with the opening. As I said earlier, I don't know, Juliana, if you were on yet, but I do have a meeting with the trustees on Tuesday. I have the most current restrictions in place due to the pandemic that we're going to be reviewing, and we've already taken measures to ensure safety as much as we can take out on the deck with disinfecting and sanitizing and so forth. Yeah, so I didn't know if anybody had any questions or.
Well, basically, you're utilizing the same system of check-in, check-out, and log as 2019. And we did approve this last year, 2020. So unless there has been any change, or I presume there hasn't been any change, Mary Beth, is that correct?
No, so Sue, can you, first of all, Susan Ebersol is the property manager at Turtle Crossing. And
Right.
just for Juliana's benefit, Juliana, we have many apartment complexes and condominium association complexes in Braintree that have semi-public swimming pools that offer that amenity to their residents. And they do have the opportunity to apply for a variance to the local Board of Health. Whichever city or town you're in, you can apply for a variance to the local Board of Health to ask for a modification of the requirement to have a lifeguard. So unless you receive a variance from the Board of Health, the requirement is that you have lifeguards on duty when the pool's in operation. But we do have a lot of complexes in Braintree that we have adult communities in Braintree that don't have a lot of children. They have minimal use on their pools. In Susan's case, she has a mixed population, but I believe it's more adult population than necessarily children population. And so they have requested for a good number of years now, probably 3 or 4 years, a request for a lifeguard provision. They're not completely eliminating the lifeguards, but requesting that during the weekdays, they not have to have lifeguards, but do have lifeguards on weekends and holidays when it's at its most peak use. Now, what's the requirements that Susan's also talking about, beside the state requirements for the operation of a semi-public swimming pool, which are the chemical requirements, which are the safety equipment requirements, there's a whole added layer of reopening requirements with COVID. So for the COVID requirements, there is a certain restriction on capacity as opposed to a normal year when you could let everyone in.
Yeah.
There's a 50% capacity limit on pools at this point with the COVID requirements. There are also cleaning requirements for all the equipment, what patrons can and can't do as associated with, what amenities in the clubhouse they might be able to use and what they can't use. So there's an added layer of restriction that must be met by the establishment in order to operate their pool than in normal years when we weren't faced with COVID. So the board in the past has approved Turtle Crossing for this partial lifeguard variance for Monday through Friday. Susan, can you just elaborate a little bit on the gate enclosure and how your residents get into the pool enclosure? I know they have to go through the clubhouse, but I know they have a keyed lock system. Can you explain that a little bit to the board and how that works? Because it's electronic, correct?
It is. So we have what we call fobs. There's a card reader, and access to the pool deck, you're required to swipe your fob to get in. So even, so we do have bathrooms as well, but even if you come out to use the ladies' room or the men's room, you have to rekey to get back out onto the deck. So it's good because it helps me be able to track who's going in and out and how many. And that's why I'm able to do these reports to show the how many people have the usage on the people. So it actually works out well. They also have to use their fob to get into the clubhouse. which
So
is
if
by the
someone uses the fob like 3 times, does that register 3 people or is?
So it would register every time. So
Okay.
what I do when I do these reports, I go through it. I try to take out the duplicates because, you know, if I know that somebody's just coming out to use the ladies' room, or if it's like 2 minutes
Right.
that, you know, they're swiping back in again, it's obvious that they just stepped out for a second.
Right.
and
When
then-
I had read it, that's what I thought. I saw duplicates, so I thought the numbers
Yeah,
actually might
I
have been.
know. I try to get them all, but it can be confusing.
I have no issues.
So one of the things that Susan asked prior to the meeting starting was if the board had any concerns about who she allows act with the COVID restrictions in place. It's a 50% capacity. If the board had certain restrictions or, you know, requirements as to who's let in, whether it be a resident or a guest. And the requirements are not that specific. That's more of an operational thing that you would need to make a decision, Susan, you and your board, who you would allow in. I mean, I'm sure that based at, you know, in speaking with your board, you definitely want it to be equitable so that all people are able to use the facility if they'd like.
I don't think that's anything we should get
It has
involved
nothing to do with the health
Probably
department or the
right.
board, no.
with. Right.
And does the health department have any additional requirements other than what I'm seeing from the state?
So you have the state health department, state requirements for the operation of the pool, which you're a certified pool operator or whomever is maintaining your pool, Tim, I believe it is, would contact us to schedule inspections prior to opening. And I know traditionally you try and open prior to Memorial Weekend.
We open that weekend, yeah,
Okay.
the Saturday of Memorial Day.
So we would need to be doing inspections. I mean, we can start doing pre-opening inspections in May, early May, to get you all set up and ready to open.
Great.
Would
So
some-
my
Not sure if-
recommendation would be to approve the variance.
I approve.
I was
I-
gonna let Juliana do her first one. Would you like to second that, Juliana?
I second that motion.
All in favor? Aye.
Okay, and I need a roll call. So Dr. Bergoli,
Yes.
Dr. Nettleman,
Yes,
and Ms. Melchanda.
Yes,
That was tough. A lot of weight on those shoulders.
a lot of weight over here. I was gonna say, I was reading this research study this week, actually, that pools, they're finding the chlorine chemicals are killing COVID within 3 minutes. So pools are becoming more of a somewhat safe environment in regards to COVID.
good. Glad to
Whereas
hear that.
at first you hear like the thought of going in a public pool 9 months ago grossed me out. But after reading this, I'm like, you know, it does make sense. So
Philip, I'll join you at the pool.
All right.
Well, thank you very much.
Thank you very
Thank you,
much.
Susan.
Good
You're all
luck.
set. I'm gonna
You're all
leave.
set. Thank
All
you.
right, thank you.
Thank you and good luck.
you.
Have a good
Bye.
season.
2, request for keeping of animals permit. A, Joan Hutchian, 84 Hollis Avenue, 9 chickens. Application and supporting documentation, 7 pages, plus regulation, 3 pages. Mary Beth.
I do believe that Joan is on the call. Oh, there she is, I see her. Okay. So Ms. Hutchin is requesting for the keeping of up to 9 chickens on her property located on the corner of Hollis Ave and I believe it's Ash, correct, Joan?
Yes.
Okay. And so she has a fairly large property, and in your packet, you have not only the area map of where it's located, but you also have a plot plan that indicates she's looking at 2 potential locations. The primary location is adjacent to, I believe it's a shed in the rear of the property in the backyard. And then a secondary location, if that for some reason didn't work out, would be on the side yard of the property. And in each case, it would be 10 foot from any side of either the side or the rear property lines. As the board knows, you set a minimum standard that if anyone wants to keep animals such as chickens, the coop and run has to be at least 10 foot from any property line so that does not in any way negatively impact abutters as far as being that close to a property line, in any closer proximity to the property line. I sent you all an email this afternoon with the second a butter, Mr. Noble, who is agreeable to, or has been notified. Additionally, you received in your packet, there's two abutters to the property. One is 48 Ash Street and the other one is 92 Hollis. So you do now have the notifications from both that have been notified. And Ms. Hutchin can give more explanation of what her intention is to keep the animals, how she will maintain the property as far as manure, and also security for as far as the coop and run for the chickens.
I think you should put it as close to Mr. Noble's property as possible.
But no closer than 10 feet.
And tell him I said so.
I will.
I think the property is excellent. It's large. It should be no problem at all. And I think the cleaning and keeping up. I was curious, how many places now does the department have to check now in Braintree? How many places are there that
We
have
have
permits?
We have a lot of chickens. We have well over probably 24 permits involving
Really,
chickens.
I
Yeah.
thought it was more. And then you have a few that haven't
Yeah.
applied for permits.
Right, we have goats, we have horses, we have chickens, we have rolling pigeons. We have quail, we have a number, so Juliana, just so that you know.
Interesting.
other than
People have
domestic-
pets for pigeons for pets.
Yes, well, it's more of a
Yes.
hobby. Yeah,
Yeah,
so anything other than domestic animals such as dog or cats, etc., you have to have a permit for the keeping of the animals. So any livestock, any types of exotic type birds or birds in general, things like that. So the board, excuse me, does have permits in place for ducks, chickens, quail, pigeons, goats, and I think we have some the pigs, the mini pigs, miniature pigs,
Right.
and some horses.
Teacup pigs.
Okay.
Yeah,
and this is once a month?
the inspections?
Yes.
Oh, no. So the inspections are done on an annual basis and on a complaint basis.
All right, by complaint
Right,
and annually.
right.
Okay,
Mhm.
Okay, so,
Or if the board has set conditions that it's done more often.
okay.
so we're going with number one in the back of the property, a chicken coop. Do we know the size of the chicken coop? Do we know anything about it?
I have not bought it yet. I was waiting for approval.
Okay, so again, the chickens, they're not free to run around the
No.
yard, is that correct?
No,
Mary
no.
Beth?
They will have a run.
Right. The manure will be taken care of, the waste products will be taken care of.
Yes, that'd be great garden fertilizer.
And we're looking for up to 9 no roosters.
No roosters. No roosters.
Right, so just so that you know, Ms. Hutching, roosters are not permitted for obvious
Oh, do you
reasons.
know that?
No
Yes.
roosters.
Where are you getting the plants?
Although Fred did want a rooster, Dr.
Tell
Nettleman.
Fred no.
Fred did ask for a rooster, but no.
That'd be a nice wake-up call for Braintree.
And again,
Right.
Mr. Noble might like that, huh, Philip?
Fred
That's
can
okay.
be your rooster.
Yeah, we would like a rooster.
Where are you getting the plans for the chicken coop?
We may purchase one that is already made, say from Tractor Supply. Or there are some that are for sale, already built on Craigslist. So we're shopping around.
Okay.
But we haven't purchased anything yet.
All right, very good.
Both
Good luck to you.
Both abutters have been notified and they're fine with this, Mary Beth.
Yeah, you've received letter back from them. They've signed off on the notification that they've received notice.
Would Juliana like to give her first motion to approve a keeping of 9 chickens,
Up to 9.
up to 9 at
Might not be
84 Hollis
fully 9.
Avenue? Excuse me?
It may not be 9,
Okay, but no more than 9,
no more than
up
9.
to 9, okay.
Did Juliana make a motion?
So my motion, I'm good for it, yes.
All right, I second.
All in favor? Aye. So 2
Aye.
o'clock.
Okay.
And a roll call, Juliana
Yes.
and Dr. Nettleman
Yes,
and Dr. Bergoli.
Yes.
Great, thank you. So the permit,
Just, if I could just say to Dr. Nettleman, you were my dad's doctor for many years.
Oh, okay.
Do you remember Tom Moody?
Oh, sure. Sure.
He thought the world of you.
Yes. Thank you very much.
You're welcome.
thank you, Ms. Hutchins. So the permit will be issued. We'll get that out to you.
Thank you so much.
You're
Thank
welcome.
you. Good luck.
Good luck. Right.
Oh, that's
I'll
it.
leave.
Nothing else written on my sheet.
So I did want to just update you on where we are with COVID as far as the town. So we do have, as I mentioned to you at our last meeting, effective March 1st, Governor Baker has stopped all vaccine distribution to local city and town health departments, and all of the vaccine is being redistributed to the larger vaccination sites and the pharmacies, which was a great disappointment to us because we really feel like we have a good vaccination program in place and could really benefit the town residents by helping to continue that. But as of right now, that's been discontinued.
It was a great program.
It is. Our very last second dose clinic is this Saturday. So we'll finish that up and wrap the program up. If something should change in the future with the vaccinations, I'll certainly let you know. With the most recent activity involving Johnson & Johnson, you know, there was a thought that maybe the state would roll out some Johnson & Johnson to health departments to help vaccinate, but there's been no mention of that. And I don't really know what the status of, as we all do, we don't know what the status of Johnson & Johnson will be. So what we've been solely administering is Moderna, because we do have a commercial vaccine refrige. We do not have a freezer, which is why we were never able to offer Pfizer. So the last
Honestly, better that way. I heard today that Pfizer is now requiring a third dose.
Wow. Okay, I hadn't heard that.
I'm
Because
sorry, what was that? Pfizer is what?
Requiring a third dose.
a third dose
Oh,
because
yeah.
people are getting infected after the 6 month.
I would
People that got
expect,
it in December are starting to get COVID.
Right.
I would
I mean-
expect the COVID will become an annual shot like the flu shot.
Right. So that's kind of where we're at with the vaccination program. As of today, and Juliana, you will be receiving on a daily basis, send to the board members what our daily numbers are. So we do a daily report of the number of cases that were seen on that day. And then we do a cumulative total of the number of deaths, which as of today was 136. We haven't had any recent in the last week, but it's 136 total since COVID started in Braintree. And then the cumulative total of confirmed cases since we started last February, which is over 4,400.
Thank you
So
very
we're
much.
repeating every year. And then also we do have our annual rabies clinic that will be coming up on Saturday, May 8th from 10 a.m. till 12 noon at the Town Hall Auditorium. We didn't, many communities have canceled their rabies clinic because of the COVID activity and so forth. But we don't want, in Braintree, we don't want a rabies epidemic on top of a current COVID pandemic. But it's an outside event, so we feel like we did it last year outside. We feel it's very safe environment, and we're kind of experienced at doing it, so we have no problem with that. Additionally, possibly as early as this week, this coming week. So Juliana, we are part of Norfolk County Mosquito Control District. There are 14 communities. And what they do in the springtime is they will do an annual aerial helicopter application in each of the communities in the large wetlands. In Braintree, we do have a good amount of large wetland area. So they'll do a very low flying helicopter application. It usually takes maybe not even a day in Braintree. It's a very low flying helicopter, flies, and they drop the BTI granules into the large wetlands. That's in the springtime every year. Then effective usually Memorial Weekend through possibly up till the end of September of each year, the Norfolk County Mosquito Control does a ground application. They select certain streets in the town of Braintree. They do an application between dusk and midnight, usually every Thursday. They'll go and you'll see a spray fogger truck that just drives up and down the street spraying for mosquitoes. So as early as next week, the weather dependent, we could see the application for the wetlands occurring.
Mary Beth, the rabies is just once per dog, isn't it? It's not an annual shot.
So the requirement for rabies vaccinations for dogs and cats is that if the animal is under a year old, they get a booster. And then after that, they would get a shot. So after they finish their booster, they come back the following year and then they get what's a 3-year booster, a 3-year shot that would carry them 3 years.
Okay.
Now, if they exceed the expiration of that 3 years, then they revert back to a single 1-year application and they have to start the series over again. So we try and schedule our rabies clinic so that it falls at least one day before it was administered the year before, in case someone falls in that time frame.
Okay. Thank you.
And I think that's about it for right now. So Julianne, I'd love to be able to, when you have time, just to maybe sit with you and just kind of let you know everything that you will be involved with.
Absolutely. I know I
You never
kind of
did
just
that with me.
jumped in cold turkey tonight. It
You're
was
jumping cold
kind
turkey.
of nice.
I was in the hot seat. I still have PTSD.
Julianne, I just have one thing to ask you.
Yeah.
What is that tattoo on your left arm?
Oh, gosh. If mom could hear you now, she'd give
Oh,
me a nice
Jesus.
dope slap. So when it's the coordinates of Boston.
Okay,
When I was living down south for 7 years, I missed home.
okay.
So I
all right.
decided to tattoo home on me. It'll probably be the first one to get lasered off, to be honest.
No, if you like it, keep it.
Oh, I
Philip,
like
I was
the
just
red.
wondering.
Juliana,
Okay.
Philip has Bertucci's tattooed right there on his
Yes,
forearm.
yeah.
There you go.
All
So
right.
Juliana, what exactly are you doing at Mass General? What are your duties there?
So
know
I
You were
am in a
COVID for a while, right?
We were transitioned to COVID floor last May, April and May, maybe June. It lasted for a couple months there. And so far, I'm on a cardiac step down unit. So we get a lot of arrhythmias come in, heart cath, a lot of diagnostic heart issues, chest pains, pre and post heart caths and stuff like that. But yeah, so as of right now, the COVID has kind of eased its way a little bit. We're not strictly we actually don't have any strict COVID units anymore. They kind of spread them out a little bit. Different approach since the first surge, which is, I think, a little bit more manageable, which is nice. So yeah, right now we don't have a single COVID positive on our floor, which is awesome.
Well, it's nice that you bring some COVID experience. And Juliana was part of our flu clinic this past October, which was outside. Dr. Bergoli was there as well.
I was there.
It was a very different clinic because it was outside, but I thought it went very, very well considering the change.
Now, this year, are we going to be indoors or we're going to get heaters for outside?
That's the plan. Well, I thought I remembered it being very warm.
It was
a very
warm.
warm day. We were blessed.
Yes.
Yep.
So the plan is that we would do it inside, but it's nice to know that if we ever had to, we could do it outside.
Right.
Absolutely.
So,
All right.
So that's just one of the
make a
many
motion. I make a motion, the meeting be adjourned.
Juliana, would you like to second that motion?
I second that motion.
All in favor? Aye.
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 and roll call. Dr. Bergoli,
Yes.
Dr. Nettleman,
Yes.
Julia.
Yes.
Great, thank you.
And
Thank you
welcome
guys so
again.
much.
Welcome again, Juliana.
I
Juliana,
appreciate
good
it.
luck at work.
Thank you. I'm heading home now, so this is nice.
Okay.
Oh,
And I've got a nice week off for my birthday, so this is a
Oh, gee.
Happy
nice little
birthday.
kickoff. I appreciate
Happy
it.
birthday.
Happy
Thank
birthday.
you guys. Thank you so
All
All right,
much.
see you guys in a month.
See
great.
you in a month.
Bye-bye.
Thank you.
Thank you,
Bye-bye.
Stephen.
Bye-bye.
Bye, guys.
Bye-bye.
Bye-bye.